bit about evaluation. How do we know the program is successful, effective? What do you do? How do you evaluate it?
I mean, there are a few different things that we can really look at. First and foremost is just the productive relationship that Chief Skinner really referenced. If we weren't doing a good job, I don't think that I would be here talking about this today. We wouldn't be out there, responding to calls the way that we are, collaborating the way that we are with public safety. There are, other metrics we can look at are, as Chief Skinner mentioned, Cahoots does a lot of outreach, a lot of public education. And when you see the volume of calls that are coming in through dispatch for us, many of those calls are coming in at really low priority levels, lower acuity, that might not have triggered that traditional, infrastructure to respond. And a lot of that has to do with the fact that our community recognizes when those crises are starting to emerge. There's an understanding of the triggers, and so we see folks, more apt to call in Cahoots earlier on in these crises rather than waiting for them to, kind of unfold and explode and turn into this, large dynamic public response. When it comes to, direct impact, one of the areas that we have been able to measure really accurately is also our cost savings by diverting folks from the ER or from at least an unnecessary ambulance ride. And to that extent, we see savings to our hospital systems and to emergency medicine to the tune of around $8 million a year. And that's on a program that for our metro area costs around $2.5 million to run.
Excuse me, Tim, there are a couple questions in here continuing about data. Is there easily accessible links or web pages that people can go to find out about where, the number of calls dispatched that Cahoots follow up on or actually responded to, I should say? And I guess Chief Pace, and I think I'm somewhat aware of this here in Denver, but people want to know this data. How many calls have, Star gone out on and what was the response and that sort of thing? So can you talk a little bit about that, Tim, and then Chief Pace, if you want to respond as well for Denver?
Sure. When it comes to, some direct links on some web pages, I would direct folks to either the Whitebird Clinic website or the City of Eugene's own page about the Cahoots program. Both of those websites contain information, and Sarah just tossed it in the chat here. That City of Eugene website does a really great job of breaking down, our calls, really looking at how we fit into that larger context. So there's an opportunity to really kind of see how many times Cahoots is responding to calls without, law enforcement or EMS services, how often we are responding in those more kind of co-response situations, and then some further breakdowns around things like diversion from arrest, or just kind of looking at our overall percentage of calls for different call types.
Chief, Denver is still in its pilot phase, but I know you're big on data.
Yes, Mayor. Our first 6-month report should be out mid-December. Again, this is both a quantitative and qualitative analysis. Some of our partners with the data collection include Lived Experience. Denver Homeless Out Loud is part of that evaluation committee. So ours should be out mid-December. Again, those were some of the highlights of the data that we're seeing. And then we're also having an evaluation that should be out early January from Mental Health Corporation of Denver as well. So we're looking forward to both of them. But we have, as part of monthly meetings, community members that are involved in that data. They hear where we are as far as how many calls, where we are as far as how long the call itself takes, where we are on those follow-ups or those referrals out there. And the community has led many of the qualitative aspect of it, getting that direct survey from people that have been helped or people that are just learning about this alternative response in the first place.
Appreciate that, Chief.